The subcommittee will come to order. Before we begin, I'd like to ask unanimous consent for Congressman Mike Bost from Illinois to sit on the dais and participate in today's proceedings. Without objection, that is so ordered. I want to thank you all for joining us today. This afternoon, we will be discussing 8 bills that have been referred to the Subcommittee on Health. These bills are sponsored by committee members and our non-committee colleagues alike from members on both sides of the aisle. I am grateful to each of the bill's sponsors for their interest in ensuring that the Department of Veterans Affairs is the best equipped to provide high-quality care and services that our nation's veterans have earned and certainly deserve. The bills that we'll be discussing this afternoon cover a wide variety of topics. For example, our agenda includes bills that pertain to non-institutional long-term care and clinical productivity, efficiency, and medical waste management. Also, some of the bills on our agenda today address some aspects of recruitment and retention, the considerable challenges that VA has faced in recent years when it comes to hiring have been well documented in this subcommittee. Next Thursday, we'll be holding another hearing to evaluate what, if any, progress the VA has made with the additional authorities that this Congress has provided to improve the VA's abilities to recruit new hires, bring them on board, and retain them over the course of their careers. I hope that that hearing reveals headway in the meeting staffing needs across the VA healthcare system. However, as long as the staffing concerns remain a problem for the VA, this subcommittee will continue to prioritize finding innovative ways to ensure that the VA is able to hire doctors and nurses and other providers that our veterans need. Once again, I want to thank the bill sponsors for introducing their thoughtful proposals and for their attendance here today. I also want to thank the Veterans Service Organizations who will be testifying or who have submitted statements for the record and for their willingness to lend their opinions and insights to us this afternoon. And finally, I'm grateful to the witnesses from the VA for being here to provide the Department's perspective on these bills. That said, I do want to note my disappointment that despite being provided with several weeks' notice of this hearing, VA's testimony did arrive late to the committee staff. We read your testimony carefully. We consider it seriously, and we would like to have more than 48 hours to study. I found the testimony to be very useful once it was received, and I hope the next time we'll be able to get that in a little more timely fashion. I now yield to Ranking Member Brownlee for any opening statement that she may have.
Well, thank you, Mr. Chairman, and looking forward to this hearing, and I wanted to welcome back my friend, Dr. Winstrup, who we worked very closely together on this subcommittee, so welcome back. And I too want to thank the VA and our veteran service organizations for being here today. We have some great legislation that we're considering, and your expertise and input is so valuable to us as we consider what changes need to be made to best help our veterans. The bills before the subcommittee today are practical solutions to issues affecting veterans nationwide. In particular, I am concerned about the persistent number of vacancies at the VA and feel that we must do more to bring qualified doctors, nurses, and other medical providers into the VA system. Hiring and retention within the VA has long been problematic, and today a number of the bills seek to assist VA in attracting qualified healthcare providers to treat our veterans. While we know VA offers a high quality of care, it is often a lack of access that can be frustrating for our veteran patients. By focusing on VA's HR departments and pre-medical school training programs, we can ensure VA has a pipeline of providers entering the VA and the staff to ensure they are on board in a timely manner. I look forward to further discussions of these bills and welcome any suggestions on how we can improve upon them. I thank all of our colleagues for being here and for their work supporting veterans. Thank you, Mr. Chairman, and I yield back.
Thank you very much, Mr. Brownlee. I will now introduce our first panel. It's a pleasure to be joined today by several of our bill sponsors. With us is Congresswoman Vicki Hartzler from Missouri, and Congressman Brad Wenstrup from Ohio, and he's the former chairman of this committee, Dr. Wenstrup. I will introduce the other witnesses. Oh, actually, we also have Congressman Mike Bost from Illinois is going to be a witness on the panel, and also Congressman Clay Higgins from Louisiana. I appreciate all of you taking time out from your afternoon here to discuss your legislation. Ms. Hartzler, you're now recognized for 5 minutes.
Well, thank you, Chairman Dunn and Ranking Member Brownlee and distinguished members of the subcommittee. I appreciate you allowing me time to testify on how H.R. 5521, the VA Hiring Enhancement Act. Our veterans deserve the best. Unfortunately, top-notch care is often hampered by a shortage of doctors at the VA. Now, I believe that this bill, which I introduced along with Congressman Correo and Congressman Bost, will help the VA to fill some of these vacancies. Our bill has 3 main provisions. First, it would allow physicians to be released from non-compete agreements only for the purpose of serving in the VA for at least 1 year. Non-compete agreements are supposed to prevent a physician from building up a patient base and then taking those patients with them as they set up their own practice. A physician moving to the VA simply does not fit this description. This proven provision would ensure that a non-compete agreement is never used to keep a physician from serving veterans at a VA facility and only applies to such a circumstance. Second, our bill updates the minimum training requirement for VA physicians. Completion of a medical residency is widely accepted as standard comprehensive training for clinical physicians in the United States. However, current law only requires that a physician be licensed in order to treat veterans. In the case of some medical specialties, the difference between licensing and completing residency can represent 6 years of training. Some have suggested that this provision would exacerbate the shortage of physicians at the VA by shrinking the pool from which the VA can hire. However, the VA currently hires almost exclusively those physicians which have completed residency training, so this provision would not result in such an impact. Others have rightly submitted that veterans are largely satisfied with the quality of care they receive at the VA. They therefore submit that we do not need a legislative fix to a higher standard. I contend that as long as Congress sees fit to impose any standard on the VA regarding those caring for veterans, we have a duty to ensure that that standard is appropriate. Completion of residency training is the accepted standard in this nation, and we should never expect veterans to accept anything less. This is a common sense update to something federal law already addresses and ensures that only fully trained physicians care for those who served our nation. Finally, our bill would place veterans hospitals on a level playing field with the private sector when it comes to recruiting timelines. Often, private sector healthcare providers begin recruiting medical residents as they begin their final year of residency, sometimes even earlier. Most residents have school debt they need to start paying off, an average of $190,000. During residency, they treat patients and work upwards of 80 hours a week, sometimes with single shifts up to 28 hours. These residents, rightfully motivated to secure a post-residency job with better pay and better hours, often accept a solid job offer from the private sector before VA recruiters are able to get their recruiting process even started. Our bill authorizes VA recruiters to make job offers to physicians up to 2 years prior to fulfilling all of the VA's requirements, contingent on meeting all requirements before they begin treating veterans. It offers job security to medical residents who want to work at the VA when they complete their training, and it allows VA facilities and recruiters to shore up appointments further in advance, helping them to plan and forecast medical workforce needs. VA recruiters are already pitching a great opportunity for physicians, and we owe them policies that make them as competitive as possible with private sector recruiters. I believe that advancement of this legislation will help begin to fill the VA's most vacant health care position needs. We've worked closely with this committee staff, VA recruiters, and VSOs on this bill, and I'm pleased to report that it has garnered wide support, including formal endorsement from the American Legion and Paralyzed Veterans of America. It's my hope we can work together to move this bill to the House floor soon. Thank you again for allowing me this time, and I yield back.
Thank you very much, Representative Hartzler. We now recognize Dr. Wenstrup for 5 minutes.
Thank you very much, Mr. Chairman, Ranking Member Brownlee. It's good to be with you all again. I appreciate the opportunity to be with you today. As a member of the House Veterans Affairs Committee for many years, one of my frustrations was the inability to use metric-driven standards to comprehensively examine and improve how the VA was using its resources to deliver health care. You know, we often hear when you've seen one VA, you've seen one VA. And that stands to reason in many ways. But every time I sat where you sit now and asked VHA's past leadership if they were able to provide metrics on health care delivered per resources expended, I wasn't able to get an answer. I was told the numbers existed, but they never seemed to materialize. And some would say, well, it costs more to do this, it costs more to do that, but they really had no metric of explaining how. The goal, I think, for our VA healthcare system should be to deliver quality care efficiently and in a timely fashion. If you are determined to deliver health care to all of those veterans that are eligible for care in a timely fashion, you want to make sure that you can be the most efficient. So my legislation, H.R. 6066, seeks to ensure that actionable data based on the measure of relative value units will ensure we can best serve our veterans. What is a relative value unit? It's something assigned, CMS uses it, and it gives us a value to what procedure you've just performed or what function you just performed. There are more RVUs for an open heart surgery than there is for an incision and drainage of an abscess, as you might imagine. So recently, the VA began tracking productivity metrics across more than 30 specialties, but significant gaps still exist and persist in the effectiveness and completeness of the current reporting. Last year, a GAO report that is cited in my written testimony found that current VA productivity metrics, including RVUs, called RVUs, are not complete and may not be accurate. Clinical specialties are siloed, certain inpatient work is not measured, and contract providers go unmeasured. So the data that we have is not really useful because it's not complete. And recording an RVU and scoring an RVU when you perform a procedure is very simple. You have certain procedures in your specialty that you do every day, and you document it in your note, and you can just simply point out, I did this and I did that, and then that can be scored. So this is a legislation to tackle the GAO's recommendations by tracking RVUs across all providers and providing more comprehensive and systematic review to put the data to work. And by doing this accurately, we can figure some things out. And, you know, in private sector, obviously, the more RVUs you produce, the more you get paid. It's different in the VA. You're paid the same anyway. But what we want to do is measure productivity. If you have two practitioners operating at the same time, doing the same type of work, and one is producing twice as much as the other, you can evaluate that by knowing how many RVUs you produced. So what do you do with that? In our practice, if we saw it, we would say, you know, well, this doctor has a physician assistant or two medical assistants as opposed to your one. And if we do that, we can increase the productivity. That doesn't decrease doctor time. It actually will increase doctor time with patients. So these are things that I want to bring to light. It also can affect how you're scheduling. You can learn so much. You may need to know that you need one more treatment room to be more efficient. So this is an adequate way of really determining how productive someone is, or a clinic is, or a hospital is, and can guide us on where we may need to make changes to be more effective. Last year, working with the committee, we drafted the language found in the bill in response to the May 2017 GAO report and recommendations, and from years of observation from the dais where you now sit. This language was included in H.R. 4242 when it passed out of this very committee last November, though it did not make it into the final VA Mission Act. That's why I'm introducing this language as a standalone bill. The VA, like all government agencies, is operating in a resource-constrained environment. It's our obligation to make sure that the resources we do have are directed at the veterans that need care. If we can't measure this, we can't improve it. None of us can claim to have a monopoly on good ideas, so I stand ready to work with all interested parties to make sure that every dollar we spend within the Veterans Health Administration is being used to effectively deliver care to our veterans. Thank you, and I yield back.
Thank you very much, Dr. Wenstrup. I now recognize Captain Clay Higgins from Louisiana for 5 minutes.
Thank you, sir. Chairman Dunn, Ranking Member Brownlee, thank you for considering H.R. 5693, the Long-Term Care Veterans Choice Act. My bill, H.R. 5693, authorizes the Department of Veterans Affairs for 3 years to cover the cost of long-term care and medical foster homes for up to 900 veterans otherwise eligible for nursing home care through the VA. Medical foster homes are private homes in which a caregiver provides services to a small group of individuals who are unable to live without day-to-day assistance, and they're an alternative to nursing homes for those who require nursing home care but prefer a non-institutional setting with fewer residents. For many young veterans in need of round-the-clock care, medical foster homes can provide a more age-appropriate, independent setting than traditional nursing homes. The U.S. Department of Veteran Affairs has run its medical foster home initiative since the year 2000, and today, VHA oversees more than 700 licensed caregivers caring for nearly 1,000 veterans in 42 states. To be eligible to provide care for veterans, a VA medical foster home provider must provide a background check, complete 80 hours of initial training, and 20 hours annually afterwards, and cannot work outside of the home. Unfortunately, while the VA will cover the cost of home-based primary care for eligible veterans living in medical foster homes, the VA does not cover the cost of medical foster home living arrangements for veterans otherwise eligible for nursing home care through the VA. Instead, these veterans must pay for medical foster home services out of pocket or through private insurance. Costs associated with medical foster home services range between $1,500 and $3,000 a month, which is significantly lower than the nearly $7,000 per month the VA might otherwise pay per patient at a state VA nursing home. In my home state of Louisiana, the VA operates state-of-the-art veterans homes that provide residents a high quality of care in an understanding, supportive environment. This is understood. In my district, I've toured and visited the Southwest Louisiana Veterans Home in Jennings, Louisiana, and I can personally attest to the high quality of care and sense of well-being among veterans there. But much like in the civilian world, there's no one-size-fits-all standard of care for veterans. Veterans should be afforded flexibility to use the benefits they've righteously earned and that best suits their own individual needs. H.R. 5693, the Long-Term Care Veterans Choice Act, gives much-needed choice and personal dignity back to these brave men and women who have selflessly sacrificed for our nation. I look forward to the support of my colleagues on this bill. Mr. Chairman, Madam Ranking Member, thank you for allowing me to speak on this bill, and I yield the balance of my time.
Thank you very much, Representative Higgins. You now recognize former U.S. Marine Representative Mike Bost from Illinois for 5 minutes.
Thank you, Chairman Dunn and Ranking Member Brownlee, for providing me the opportunity to testify before the Subcommittee on Health on my legislation, H.R. 5864. The VA Hospital Establishing Leadership Performance Act, or VA HELP Act. The mission of the Department of Veterans Affairs is to care for those who shall have borne the battle. When our heroes transition from the military, they deserve to have access to quality health care and service. Unfortunately, the VA continues to fall short on that promise, due in part to failures in human resource management and operations. VA's internal assessment and those by the Government Accounting Office and VA Inspector General have identified serious human capable challenges and weaknesses within the VHA's human resource operations. Most recently, we all heard about the inadequate staffing and human resource management deficiencies that contributed to the failures at the Washington, D.C. VA Medical Center. This issue hits very close to home for me. After the VA National Center for Patient Safety Survey and the Marion VA Medical at the Marion VA Medical Center, the Marion VA Patient Safety Culture Survey showed a considerable decline in key factors such as communications between management and staff and the frequency of reporting problems to management. During the site visit, multiple employees raised concerns about poor management and poor communications, distributing between leadership and management, and the lack of accountability. These factors help measure the culture at the VA facility, and it was clear that the employees were unsatisfied and that with their work environment. Following this report, General Berkman and I sent a letter to then Secretary Shulkin requesting that the VA further investigate this matter. The effort was followed up by an oversight and investigation subcommittee staff visit to the Marion VA Medical Center in order to get firsthand look at the issues at the facility. A report of the subcommittee's finding confirmed a lack of accountability, improper communication, and a lack of standards to measure the success of the HR department. We also learned that there are limited education qualifications required to be Chief of Human Resources in the VA. I do not know of any health system that has a chief of HR without a college degree overseeing thousands of employees and responsible for negotiating job offers and proposing disciplinary action. I also do not know of any health care system that would hire or promote an individual to manage or oversee a human resource department without requiring a college degree. During my time on the committee, I have seen that this is common in the VA to move problem employees into higher level jobs with greater responsibility without assessing their prior leadership experience and performance. Unfortunately, despite the subcommittee's finding and several efforts to encourage the VA headquarters leadership to address these problems, limited actions have been taken. My office continues to receive complaints about the mistrust of the medical center leadership, confusing and inconsistent in its disciplinary process, and failures to track employee performances and outcome. Human resource management is a critical part of delivering quality health care. HR is responsible for recruiting, retaining highly qualified personnel and professionals, and the current status quo within the VHA's HR offices cannot continue. H.R. 5864, the VA Help Act, will ensure that the VA addresses deficiencies within its Human Resource Department by giving it the ability to compare the performance of the departments across the VHA and measure their successes. The straightforward legislation instructs the Secretary of VA to establish qualifications for human resource positions within the Veterans Health Administration. It also requires the VA to establish standardized performance metrics for human resource positions. These common sense reforms will ensure that the Human Resource Department at the VA medical centers are operating on a uniform standard and that it is clear who qualifies to hold such important positions. In closing, I would like to thank Representative Sinema for her helping to introduce this legislation and would like to thank you, Mr. Chairman, and Ranking Member Brownlee for allowing me to testify before the subcommittee. I hope that we can work together on H.R. 5864 to ensure that our nation's veterans are being provided for with the best possible care from our VA employees. And with that, Mr. Chairman, I yield back.
Thank you, Representative Bost. I now recognize for 5 minutes Congresswoman Jennifer Gonzalez-Colon.
Thank you, Mr. Chairman Dunn and Ranking Member Brownlee for having this hearing today and all members here. And thank you for including H.R. 5938, the Veteran Service Veterans Act, as part of the agenda for this afternoon. As previously stated on several occasions before this committee, the Department of Veterans Affairs suffers chronic staffing challenges that complicate the delivery of proper and timely care. These challenges are often exacerbated by a time-consuming hiring process. The VA facilities within my district are not exception to that. As a matter of fact, this issue never fails to come up during meetings with veterans in Puerto Rico. Therefore, as an effort to identify a remedial option, my bill seeks to amend Section 208 of the Choice and Quality Employment Act of 2017 to include military occupational specialties of soon-to-be discharged service members that correspond to vacant positions in the VA in the recruiting database, as well as service members' contact information and the date of discharge. Employment after separating from the military is beneficial for veterans from psychological and financial perspective. My bill will require the VA to first coordinate with the Department of Defense to identify soon-to-be separated service members with military occupational specialties needed by the Veterans Administration and obtain their date of separation and basic contact information. Second, to maintain a database searchable by the VA personnel for purposes of hiring soon-to-be separated service members. And third, implement a direct hiring and appointment procedures for vacant positions listed on the database for service members who apply for these positions. Another objective of this bill will require the VA to implement a program to train and certify former DoD healthcare technicians as intermediate care technicians, or ICTs, to address the large demand for healthcare providers at the Veterans Health Administration. Currently, these very skilled technicians trained by the Department of Defense at a significant taxpayer expense have difficulty gaining employment in their field after separating from armed forces due to the lack of a certification. At the same time, the Veterans Health Administration have significant shortages of providers. But they instituted the Intermediate Care Technician Pilot Program, or ITCs, in 2013 to train and utilize ICTs at the VA facilities in a variety of roles. The program has since then received remarkable satisfaction rates and helped fill a void of medical providers. Implementing a program to train and certify eligible veterans to work as ICTs will help formalize the process, as well as provide for continued program support and expansion, ensure rigor in curriculum development, competency assessment, program monitoring, and allow the pool of eligible ICTs to continue growing to meet veterans' healthcare needs. Mr. Chairman and members of this committee, it's important to keep in mind that service members are a remarkable asset upon transitioning from military service. This bill seeks to further close the gap between transitioning members and the VA by helping them occupy positions currently in demand and provides an opportunity for greater access to medical care. Moreover, it allows for veterans to be cared for by fellow veterans in ways that are most needed by the VA. As a former state legislator in Puerto Rico, I'm aware that no bill is set in stone, and legislation is often the product of several reviews and revisions. And I look forward to receive the feedback of this panel and welcome any comment or suggestion on ways that we can move this forward. But I want to thank the people from the American Legion and the Disabled American Veterans and the Military Officers of America for their support for this bill. With that, I yield back the balance of my time.
Thank you, Representative Gonzalez-Colon. I will now recognize former United States Air Force veteran, Representative Jeff Denham from California for 5 minutes. You are recognized.
Thank you, Mr. Chairman. It's good to be back with a committee that I spent a number of years on as well, fighting for Americans' veterans. This opportunity to speak on H.R. 5974, the Cost Savings Enhancement Act, introduced this bipartisan bill to improve care for our veterans and ensure we are using the latest cost-saving technology. Specifically, this deals with VA medical waste, in facilities across the entire country, resulting in huge savings within the next 5 years. System-wide, this will save the VA millions of dollars each year and directly improve safety and health care for our veterans. The medical waste is known as red bag or biohazardous waste, is infectious waste produced at VA facilities and hospitals. Since this waste is contaminated by bloody and bodily fluids, it poses a risk of transmitting an infection and has been handled in a special way. If a VA facility was doing this on-site sterilization through these large machines, this waste can be not only disinfected immediately, but also avoiding costly off-site movements, meaning that this waste, which can't be compacted, fills trucks very, very quickly, ends up with a lot of trucks on the road, and as we've seen from other national disasters, this infectious waste could end up in the wrong areas within our community. So handling it on-site is not only a huge cost savings, but handling it on-site is also much safer for our veterans, as well as the communities that this would normally be trucked through. On the cost side, currently technologies can treat waste for 7 to 9 cents per pound compared to 30 to 60 cents off-site. So again, we're wasting millions of dollars each year shipping this infectious waste around the country. This bill stops that. The VA recognizes the benefits of this technology, and approximately 20% of the VA facilities already have these machines on site. But unfortunately, they've been very slow in expanding these across the country. In 2016, the Milcon VA appropriations bill acknowledged the huge cost savings as well as the beneficial environmental impacts and the energy savings associated with on-site medical waste treatment. The VA developed a blanket purchase agreement to streamline the purchasing of these machines, but unfortunately, again, implementation has been very slow. It's time to realize the full benefits of this technology and bring the VA into the 21st century. Our veterans deserve the highest quality care we can provide. This technology improves the crisis readiness and is safer, more efficient, more cost-effective, and environmentally friendly than traditional medical waste disposal. Installing these machines immediately can begin the savings of millions of dollars for the VA and directly improve our care for our veterans. I urge my colleagues to support this policy.
Thank you very much, Representative Denham. Once again, I thank all of you for being here and for sponsoring these bills on our agenda this afternoon. The first panel is now excused, and I will pause while the members of the second panel settle themselves here at the table. I will now welcome the second panel to the witness table. Joining us on the second panel is first Mr. Roscoe Butler, the Deputy Director for Healthcare, Veterans Affairs, and Rehabilitation for the American Legion. Jeremy Villanueva, the Associate National Legislative Director for Disabled American Veterans. Kaida Kelleher, the Associate Director for National Legislative Service for the Veterans of Foreign Wars of the United States. And Ms. Jessica Bongiorni, Acting Assistant Deputy Undersecretary for Health for the Workforce Services for the Veterans Health Administration of the U.S. Department of Veteran Affairs. And joining Ms. Bongiorni is Dana Cooper, the Director of Home and Community-Based Programs for the Veterans Administration. We'll begin this afternoon with Mr. Butler. You're now recognized for 5 minutes.
Thank you. According to a March 2017 study commissioned by the Association of American Medical College, there would be a shortage of more than 100,000 doctors by 2030. According to a September 2017 VA OIG report, the largest staffing shortages in the Veterans Health Administrations were medical officers, nurses, psychologists, physician assistants, and medical technologists. Many of the bills being discussed today are designed to address VHA staffing crisis, and the American Legion thanks this subcommittee for holding this important hearing. Good afternoon, Chairman Dunn, Ranking Member Brownlee, and distinguished members of the Subcommittee on Health. On behalf of the National Commander Denise H. Rowan and the American Legion, the country's largest patriotic wartime veterans service organization, comprising over 2 million members and serving every man and woman who has worn the uniform for this country, we thank you for the opportunity to testify on behalf of the American Legion's position on the following pending and draft legislation. H.R. 2787, Veteran-Specific Education for Tomorrow's Medical Doctors Act. This bill will establish a pilot clinical observation program within the Department of Veterans Affairs for pre-med students preparing to attain medical school. The American Legion is deeply troubled by staffing shortages within the Department of Veteran Affairs, particularly within the Veterans Health Administration, and has consistently voiced concerns since the inception of our System Worth Saving program in 2003. The American Legion has identified and reported staffing shortages at every VA medical center and reported these critical deficiencies to Congress, VA Central Office, and the President of the United States. The American Legion believes this bill will make a difference and supports H.R. 2787. H.R. 3696, Wounded Warrior Workforce Enhancement Act. The American Legion believes due to the shortage of physician and critical specialized areas, such as orthotics and prosthetics, Congress must ensure resources and fundings are available to support continuing education and training of such physicians. We know as the number of veterans needing orthotics and prosthetic services increases, there will be a continued need for clinicians at the master's degree level to meet this increasing demand. For this reason, the American Legion supports H.R. 3696. H.R. 5521, VA Hiring Enhancement Act. The American Legion has long expressed concerns about staffing shortages at Department of Veteran Affairs, Veteran Health Administration medical facilities, to include physicians and medical specialist staffing. We, the American Legion, believe the VA Hiring Enhancement Act will help ensure when a qualified physician who is an applicant for an appointment to a position in the Veteran Health Administration has entered into a covenant not to compete with a non-department facility, the individual will not be barred from accepting an appointment to a position in the Veterans Health Administration. The American Legion believes enforcing non-compete agreements to VA hires is overly broad and should be unenforceable under public policy. Traditional reasons behind non-compete agreements to bar competitive advantages to protect sensitive information simply do not exist in this context. For this reason, the American Legion supports 5521. The American Legion also supports H.R. 5693, Long-Term Care Veterans Choice Act, and H.R. 5938, Veterans Act of 2018. However, the American Legion does not have an official position on H.R. 5864, VA's Cost Saving Enhancement Act, and the draft bill to improve the productivity of the management of the Department of Veterans Affairs, health care, and for other purposes. In conclusion, the American Legion thanks this subcommittee for the opportunity to voice the position of the over 2 million veteran members of this organization, and I'm available to answer any questions that you and the subcommittee may have.
Thank you very much, Mr. Butler. Mr. Villanueva, you're now recognized for 5 minutes.
Thank you. Chairman Dunn, Ranking Member Brownlee, and members of the subcommittee, thank you for inviting DAV to testify at this legislative hearing of the Subcommittee on Health. DAV, a nonprofit veteran service organization comprised of over 1 million wartime service-disabled veterans, is dedicated to a single purpose: empowering veterans to lead high-quality lives with respect and dignity. As a service-disabled veteran myself, and one who uses the VA healthcare system, I am pleased to be here to present DAV's views on the bills under consideration by the subcommittee. H.R. 5521, the VA Hiring Enhancement Act, would render non-compete agreements between an applicant for VA employment and a previous employer non-applicable with regard to VA employment. Employees appointed with this understanding would be required to serve at least 1 year in their position or the remainder of their non-compete agreement, whichever is longer. The bill would also authorize VA to hire, on a contingency basis, physicians completing residencies not later than 2 years after appointment. If the contingent employee has not satisfied VA requirements for the position in that time, that individual will not be appointed to the position. DAV supports efforts to recruit, retain, and develop a skilled clinical workforce to meet the needs of veterans. We thereby share the goal of this legislation in creating as large as possible an applicant pool for qualified medical professionals to treat our service-disabled veterans in the VA. DAV Resolution Number 228 calls for effective recruitment, retention, and development of the VA healthcare workforce. Because this measure attempts to reduce barriers for the VA to hire physicians, we support the intent of this bill. We thank the subcommittee for considering H.R. 5693, the Long-Term Care Veterans Choice Act that would improve VA's medical foster home program. Medical foster homes enable those veterans with serious chronic conditions that meet nursing home level of care to remain in a residential environment instead of being institutionalized. Participation in this program is voluntary, and veteran residents have reported very high satisfaction ratings. Currently, veterans who wish to reside in a medical foster home but are unable to pay the approximately $1,500 to $3,000 per month are not able to utilize this program. So many are placed in nursing homes at much greater cost to the VA. Moreover, VA would pay more than twice as much for nursing home care than if the VA was granted this bill's proposed authority to pay for VA medical foster homes. Mr. Chairman, we must be fully cognizant of our aging veteran population's need for programs such as this. DAV's Resolution Number 227 calls for legislation that increases access and improves long-term services and supports for service-connected disabled veterans. To allow a veteran to stay in their community while receiving the best quality of care and maintaining a semblance of independence would in some small way show this nation's gratitude to those who have sacrificed for it. DAV strongly supports this legislation and calls for swift passage. H.R. 5864, the VA Hospitals Establishing Leadership Performance Act, would establish qualifications for each human resource position with the VHA, establish standardized performance metrics for each such position, and submit to Congress a report that details the actions taken. The VA has long needed improvement in the performance of their human resources staff. This has been noted by organizations such as the Commission on Care and the GAO. Each organization has indicated that an administration-wide improvement requires systemic changes that would fundamentally alter the operations, leadership, and guidance of the current human capital management system. We believe that H.R. 5864 offers a good starting point for the fundamental overhaul of VA's human capital management system, but it's only a start. VA also needs to look at streamlining and simplifying its recruitment and hiring practices. It needs to look at different programs and practices for staff retention, development, employment benefits, and performance management to maximize employee engagement. Most importantly, human capital management reform will require a long-term commitment from VA's leadership and Congress. However, the intent of H.R. 5864 will likely not be fully realized if VA is incapable of hiring or developing the human talent necessary to fill these positions. DAV supports this legislation in accordance with DAV Resolution Number 228, which calls for a simple-to-administer alternative VHA personnel system in law and regulation, which governs all VHA employees, applies best practices from the private sector to human capital management, and supports pay and benefits that are competitive with the private sector, and Resolution Number 221, which supports VA's use of meaningful and clearly articulated measures to gauge employees' performance. Mr. Chairman, this concludes my testimony, and I would be pleased to address any questions related to the bills discussed today.
Thank you, Mr. Villanueva. Ms. Kelleher, you are now recognized for 5 minutes.
Chairman Dunn, Ranking Member Brownlee, and members of the subcommittee, it is my honor to represent the women and men of the VFW and our auxiliary. The VFW agrees with the intent of the Wounded Warrior Workforce Enhancement Act, but has some serious concerns which prevent our organization from providing support at this time. One of VA's 4 statutory missions is to educate and train health professionals to enhance the quality of care provided to patients within VA. VA accomplishes this through coordinated programs and partnerships with affiliated academic institutions. Section 2 of this legislation would require VA to provide grants to orthotics and prosthetics graduate programs, which are accredited by the National Commission on Orthotic and Prosthetic Education in cooperation with the Commission on Accreditation of Allied Health Education Programs. These grants would be eligible for use at the selected institutions to expand sites, build infrastructure, supplement salaries, provide financial aid, or purchase equipment. While providing this in such ways, these grants could be of value to VA and VA patients, but the VFW does not believe this legislation would be of value in the way it is currently written. This is because the grants may be paid to institutions without any tie to VA. Priority for grant recipients would go to institutions partnered with VA, but is not a requirement. For institutions applying for the program, they must show a willingness to participate with VA, but again, they are not required to actually participate. The VFW believes for these institutions to receive these grants, they must agree to some level of partnership and participation with VA. Section 3 of this legislation would provide a larger grant to one institution to become a center of excellence for orthotics and prosthetics. VA and DoD already have these facilities which provide those best practices to veterans. This grant would also not require any form of partnership or participation from these institutions with VA. The VFW cannot justify outsourcing valuable VA resources to bolster a non-VA entity that would not benefit veterans. The VFW is pleased the VA Hiring Enhancement Act would remove non-compete contracts for providers who want to work for VA and supports removing this barrier to employment. Though the VFW cannot support the remaining provisions within Section 3, which would limit VA's hiring pool for healthcare providers, as well as duplicate current law providing VA the authority to make job offers to current residents. We are all aware that VA currently has 38,000 job vacancies. These vacancies must be significantly reduced before the VFW feels more restrictions may be put upon VA regarding who the agency may hire. To address quality of care, which VFW members prefer from VA, we must address access to care. The VFW agrees with the intent of the Veterans Serving Veterans Act of 2018, but has concerns with the legislation as it is currently written. This legislation would establish a database worked on by DoD and VA, and this technology would withhold information of individuals currently serving in the military with job positions which are needed within VA. Service members wanting to opt out of this database and having their personally identifiable information shared with an array of VA employees would be required to submit a letter. This database would then be used by VA to recruit potential employees for DoD before they exit from service. Aside from our concerns over the access to this personal information, the VFW believes these service members should have to opt into the database and that they would also still be subjected to experiencing bureaucratic difficulties while switching from DoD to VA. The VFW agrees that DoD and VA need to work together to identify medical professionals currently serving who are interested in coming over to VA, and that these individuals need to have their credentials streamlined so that the day they receive their DD-214 in hand, they can walk into their new office at VA. The VFW agrees with the intent of the draft legislation to improve productivity of the management of VA healthcare, but has some concerns with it as currently written. RVUs are used as a national standard for determining budget expenses, cost benchmarks, and productivity within the private sector. They are primarily used in the private sector to determine provider payments, something that is not an issue for VA providers on a government salary. The VFW believes there is a value to tracking RVUs within VA, and our organization also believes that as funding increased, and hopefully continues to increase, that the RVUs would show an increase in productivity. With that said, the private sector is not required to publicly report most data that VA is required to publicly report, and that includes RVUs. While this legislation would take into account non-clinical duties, the VFW is concerned about more double standards possibly being held to VA. Chairman Dunn, Ranking Member Brownlee, and members of the subcommittee, this concludes my testimony. Thank you again for the opportunity to represent the nation's largest combat veterans organization, and I look forward to taking your questions.
Thank you, Ms. Kelleher. Ms. Bongiorni, you are now recognized for 5 minutes.
Good afternoon, Chairman Dunn, Ranking Member Brownlee, and members of the subcommittee. I'm accompanied today by Ms. Dana Cooper, Director of Home and Community Care from the Office of Geriatrics and Extended Care. We appreciate the opportunity to discuss VA's views on pending healthcare legislation, much of which is aimed at bolstering VA's critical workforce management programs. There is one bill, the draft VA Cost Savings Enhancement Act, for which we are unable to provide views at this time because it came late to the agenda, but we will follow up with the committee as soon as possible. Chairman Dunn, we appreciate the committee's focus on the topic of human resources as a key to filling the department's mission of serving veterans. We are grateful for the human capital authorities extended to the VA in recently passed VA Mission Act and in last year's VA Choice and Quality Employment Act. As just one example of how those new laws have helped VA, we have recently developed a joint program with the Department of Defense called the Military Transition and Training Advancement Course, which is an entry-level program that allows transitioning service members to be trained in occupations before they separate and then make a seamless transition into the VA. We're trying this right now in the National Capital Region. In the interest of being brief, I'll highlight a few points regarding the bills on the agenda today, and of course our written testimony provides further details. VA supports the intent of H.R. 2787, the Vet MD Act, to develop a clinical observation pilot program within VA for pre-medical undergraduate students to shadow physicians. However, we do note in our testimony concerns about high unfunded costs, implementation challenges, and suggestions for improvements. VA continues to recommend providing clinical observation opportunities for all pre-health occupation students rather than focusing exclusively on pre-medical students. In addition, VA recommends including both undergraduate and post-baccalaureate students, since these students have displayed interest in pursuing health careers. We would be glad to discuss further with the committee how we believe the bill can be approved. H.R. 3696, the Wounded Warrior Workforce Enhancement Act, calls for establishing a new or expanding existing prosthetic orthotic graduate programs and the establishment of one prosthetic orthotic research center of excellence. VA does not support this bill because we believe VA already fulfills the intent, using interdisciplinary teams that provide rehabilitation services to veterans' unique needs. VA offers these in-house services at 84 laboratories across VA. In addition, VA contracts with more than 600 specialized vendors. Through both in-house staffing and contractual arrangements, VA is able to provide state-of-the-art, commercially available items ranging from advanced myoelectric prosthetic arms to specific custom-fitted orthoses. H.R. 5521, the VA Hiring Enhancement Act, would give VA additional tools in the hiring of Title 38 employees, and in particular physicians. Non-compete clauses often prevent VA from freely hiring physicians from the local medical community. Exempting VA from these restrictive and non-applicable covenants would prove beneficial. VA would hope to restrict this section to physicians hired under 74011 of this title. Section 3 of the bill would permit VHA to make a contingent appointment as a VHA physician on the basis of physician completing their physician residency training. VA endorses Sections 1 and 2 of this bill, however, has concerns with Section 3 and requests the opportunity to discuss with the committee. We appreciate the vision and compassion outlined in H.R. 5693, the Long-Term Care Veterans Choice Act, which will help VA meet the escalating demand for nursing home care, which is projected to double over the next decade for Priority 1A veterans, while also providing veterans a choice. VA covers 100% of their nursing home costs. However, if these veterans with highly service-connected conditions would prefer to receive their care in a VA medical foster home, they must pay out of pocket at an average cost of $2,400 per month because VA does not currently have the authority to pay. This bill will help VA meet this increasing demand for nursing home care by offering the option of a VA-approved medical foster home while simultaneously reducing the need to build more nursing homes or double VA's nursing home expenditures. H.R. 5864 VA HELP Act proposes to standardize qualification requirements and performance metrics for human resources positions. VA does not support the intent of this bill, but does support efforts to professionalize the HR function throughout government. Creating VA-specific standards would negatively impact VA's ability to retain current staff or recruit HR professionals from other federal agencies. VA is currently developing standardized performance metrics for HR specialists to be implemented in FY19. If a decision is made to proceed with the bill, VA requests the opportunity to meet with the committee to propose revisions to language to address our concerns. Regarding the draft Veterans Serving Veterans Act of 2018, VA supports the intent of this bill. However, we believe VA is able to accomplish the content of this bill with existing authorities. Efforts are already underway to target transitioning military members for mission-critical and difficult-to-fill positions by using data contained in a VOD database that already exists. The resource has resulted in a recruitment pipeline that will now allow VA to reach out directly to transitioning service members. Finally, the draft bill to improve the productivity of VA healthcare calls for VA to track relative value unit production standards and includes other associated requirements. VA does not support the bill as we already track RVUs for licensed independent providers, and performance standards and productivity targets are established with annual reviews currently in place at a minimum. VA has significant concerns about the mandatory training required in the bill, which would take providers away from providing direct patient care. VA would like to discuss this bill with the committee. Mr. Chairman, this concludes my testimony. My colleagues and I are prepared to answer questions.
Thank you, Ms. Mongiorni, and thank the entire panel for being here. We'll move to the questioning portion of the panel now. I do want to make mention that votes may have been moved up maybe as early as 4:15, so I'm going to ask the members of the panel to make their questions succinct, to give the panel witnesses maximum time to answer. And I'm also going to ask the witnesses on the panel to try to be concise in your answers so that we can get as many questions in as we possibly can. I now yield myself 5 minutes. I'll start with Ms. Bongiorno and Ms. Cooper. Many of the bills on today's agenda have financial scores that will require offsets before they can potentially move to the floor. Will you commit to working with the subcommittee to find offsets within our jurisdiction for the proposals that you support?
Yes, we will.
Excellent. Again, Ms. Bongiorno, when do you expect to have a cost estimate for H.R. 5521, the VA Hiring Enhancement Act, available for us to look at?
I believe we will be able to have that within the next 2 weeks, if not sooner.
Okay, excellent. We'll be looking for that. Ms. Bongiorno, your opposition to Section 3, H.R. 5521, the Hiring and Enhancement Act, is based on the fact that you think the VA already has rules requiring completion of residency. The wording of that is such that it's residency or its equivalent. What is the equivalent to completion of a residency in VA standards?
The equivalent is something that's determined by the Professional Standards Board to have met the intention of a residency program. It's extremely rare for us to hire people who have not gone through a residency program.
Would not it be more transparent and easier to simply require the staff physician, in order to be a staff physician in a VA facility, you have to complete residency training? Just say that outright?
It may be.
All right. We think it might be, too. Ms. Kelleher, your opposition to Section 3 of H.R. 5521 was that you thought it might be duplicative of current law. We looked at that same law. We thought that it did not apply to physicians, but rather other professionals in the VA. Do you interpret that law differently than we do?
Yes, Mr. Chairman, we do.
So you feel pretty confident in that?
Yes, sir.
All right, well, let's talk about that. Ms. Bongiorno, how many more veterans do you think would elect to receive? Let me change the order of these questions. How many of the veterans currently in medical foster homes would otherwise be entitled to VA paid nursing home care?
I'm going to defer that question to Ms. Cooper.
Excellent.
Okay. Currently, there's just under 300 veterans in medical foster homes that are paying for their care that would be eligible to receive the payment under this bill. There are approximately 15,000 veterans that are receiving care in Priority 1A veterans that are receiving care in a nursing home. We anticipate that there would be approximately 5,000 of those that would down the road be choosing medical foster home.
So you anticipate a future demand of approximately 5,000 veterans?
Based on our current...
If we were to open this up?
Correct.
All right, well, that answered my next question, and I think I will be careful with the committee's time, and I'll yield now to Ms. Brownlee, the ranking member.
Thank you, Mr. Chairman. I wanted to talk a little bit about H.R. 6066. So, Mr. Villanueva, could you talk to me a little bit about, I know you've already said something about this particular bill, but with regards to, how your membership feels and sort of trying to outline for the committee some of the differences between VA delivery of health care and productivity to the private providers.
Thank you for that.
This is the RVUs, the measurement, productivity.
Right. And thank you for that question. It'd be my pleasure to answer that. Essentially, we don't have a position on this bill as of yet. We do believe that there are still some clarifications that need to be made. Specifically, what exactly these RVUs would be used for, how they would, receive them from the private care community, and what exactly, how they would be comparing them, because we do believe that with the VA being a capitation system and the private care community not, that it would be essentially, like I believe one of my colleagues at this table has said, be tantamount to, comparing apples to oranges.
Yes, thank you. As my colleague next to me stated, we do have concerns with the apples to oranges comparison. I think everybody has kind of beat it over the head here with VA and their productivity varies compared to the private sector, not just based on income, but also on quality of care. VFW has conducted multiple surveys in recent years, and we get consistent feedback from our members. Some quotes, we have a World War II veteran from Florida that said, VA doctors listen to me and take time to explain the answers to my questions. Or we have others that say they treat me like a hero and give me the time that I actually need. That was a Vietnam veteran. And with that said, the number 3 problem that our members say they face when using non-VA care is actually timeliness, and they feel rushed with their providers. So we don't want that to be an unintended negative outcome.
I think in some way we're going to have to figure out how to measure productivity, but also putting a value on the fact that doctors, medical professionals within the VA spend time with veterans to answer their questions. We're asking more and more for doctors to screen for various other things that they might not have an appointment for, and I think we place a value on that, but somehow understanding that we're placing a value on that, but also being able to properly measure our efficiencies and productivities as well. So somehow, some way, we're going to have to figure that one out. On the, this is to Mr. Butler on the Mr. Higgins, by the way, I like your bill. I think it's a good bill. So, to Mr. Butler, so is this a bill that's important to your membership? And I think it is, but if you'd express to us why. Yes.
Currently, right now, veterans aren't eligible, VA is not eligible to pay for care for veterans. They just refer veterans to foster home. So any veteran who's eligible for nursing home care, this bill gives VA the authority to pay for their care in medical foster homes, which could result in a significant cost savings to the VA and the government. So we fully support the bill because we believe that any money saved is a benefit to our nation veterans and the American taxpayer.
And I mean, this is for any of the VSOs. Do you feel an increased demand for a program like this amongst your veterans?
I personally have not heard specifically from VFW members, but as
do you think they know about the program?
Personally, probably not, but I do hope they do. As we see the population of veterans continuously age, I think we can all agree that we're going to see them not only knowing the program more and more, but requiring it as well. And I would assume that the quality outcomes are much better than putting them in an institutionalized setting.
Anybody else have a comment? No. With that, I'll yield back.
Thank you very much, Representative Brownlee. We now recognize Congressman Higgins for 5 minutes.
Thank you, Mr. Chairman. Ms. Bongiorni, thank you for your service to your country, madam. Do you see my bill 5693 as a net win for America and Americans veterans?
Yes, thank you for the question.
That's
sir.
a short answer. We can stop, Mr. Chairman. I yield back. I yield to balance my time. America wins, veterans win, baby. That's why we're here, right?
Well, I thank you, Congressman Higgins. Let me say that as a veteran, when you retire and you need care, I'll give you care in my own home. How's that? We now recognize Representative Custer for 5 minutes. Thank you.
Thank you very much, Mr. Chairman, and thank you to our panel and to all of our colleagues introducing these bills. This is a great array of bills, and I particularly appreciate the help from the VSOs and from the VA as we sort them out. I want to start by focusing my attention on Mr. Wenstrup's bill because we had a roundtable this morning with Dr. Rowe. We were talking about the issue of general medical education and increasing the number of physicians being trained at the VA going forward. And we were talking about what I would consider to be unintended consequences of Dr. Wenstrup's concept about measuring these RVUs as they are measured in the public domain, in the in private medicine, and trying to compare that to the VA. And in particular, I think the VFW testimony talked about there is value in tracking, but you have to be careful because of the non-clinical burdens on VA healthcare providers. In particular, could you comment, and to the VFW, but if anyone else wants to comment, on the obligation of supervising medical training. And so, for example, during residency, you know, Dr. Rowe talked at length about the amount of time that takes, and you're not as efficient when you're doing that. Could you comment on that, and also the specifics about other elements that are different? For example, the physical facilities, you don't have the same ratio of rooms for medical appointments that you do in the private sector. You don't have the same ratio of support staff that you do in the private sector. How do these factors change the equation from trying to compare apples to apples with RVUs?
Thank you for the question. I'll try to go in order of the way that you did ask. In regard to training, VA does provide ample training to America's providers, whether they end up at VA or not, and that is clearly very time-consuming. I know I use VA for all of my health care, and I've had many times where my provider asks before the appointment if it's okay if they have new residents come in because they are going through and explaining things more by process. There's chances that the resident is not going to be as understanding of things. So that's clearly a very timely constraint on VA, and if they're taking in more residents and doing more training than in the private sector, that would be one great example of how the RVUs could have a negative comparison. VA also does a lot of research. They don't, as you said, have all of the staff that in the private sector they may, and the subcommittee and the committee at large has done wonderful at trying to address those needs within VA. We're just a little off still on the timing. We do believe that the RVUs could provide great outcomes. We do think that you're going to see the productivity continuously increasing for VA, but we are concerned about the way that will be used. Is that going to be used for appropriation purposes? Is it going to be used? Are we going to have a journalist pick it up and want to do another big article about VA being less proficient maybe than private sector when the private sector isn't publicly making that data available simply because they don't have to, so why would they? So it's something that we definitely are interested in continuing to talk about with the committee.
Thank you very much. And I do want to say on the record, I'm all for efficiency and would like to have further conversations about that. I do want to make sure to get on the record that I support Mr. Denham's bill with regard to medical waste. I'm a co-sponsor of that bill, and just experience that I have on the private sector with disposal of medical waste. I would like to work with you all going forward to pass that bill. And then my time is very limited, but I did have a quick question on, if I can get it in, I may have to take it for the record, but this was on the whole issue about I'm sorry, excuse me, the performance, but my time is up, so I'll come back another round. Thank you.
Thank you, Representative Custer. And I recognize Congresswoman Gonzalez-Colon for 5 minutes.
Thank you, Mr. Chairman. I'll go directly with Ms. Bongiorni. Yes, right? Okay. First of all, I want to say that I do support Mr. Higgins' bill. And I don't know if you cook, so you can have both. But anyway, you said that you have underway some of the proposal of the bills under the Veterans Administration. I want to know how many of those veterans or service members that were not working anymore at the Armed Forces are already being hired at the Veterans Affairs Administration. Do we have a rate?
How many veterans are we hiring?
No. How many, you say that you already have the database. You're sharing the information from the Department of Defense with the VA, correct?
Yes.
You're having that effort already undergoing.
We have just received access to the data, and so our targeted marketing towards specific occupations will be starting by the end of this month.
Okay. So how long will it take for you to make the whole program works? Because you said in your written statement that it will take at least 180 days to make that happen.
Yes. So thank you for the question. I think that we're in looking at what was actually the initial draft of what's in the current law for the VA Choice and Quality Employment Act. We are right now using our existing personnel database to fulfill that requirement. The data that we are receiving from DoD is specific to the transitioning service members. Right now, that's not linked. The two systems aren't linked. And so we would need some time, if that is the long-term intent, to link those two sources of information. But right now, we are able to go ahead and use the data about the transitioning service members to market to them.
So it could be less time?
Yeah.
Okay. So I like that answer. And then my second question will be, you're saying that there's the intent of the administration to use not just the Department of Defense data, but using the whole government to make that happen, correct?
Could you elaborate on your question?
You said that the administration wants to extend the database portion of the act of government-wide intention to have access to the rest of the government instead of using just the Department of Defense.
I am not certain what
in your written statement. In your written statement, that's the implication. That's what I read in that statement. That the intention was not just the Department of Defense using the database, but extending that to the rest of the government.
As a long-term plan, but VA
Exactly.
is not actively pursuing that right now. Yes.
But it's on your written statement, so maybe a long-term option is there. Right?
Yes.
So I do understand that this bill that we just filed could be the best pilot program to have in the public law to be enforced, and you already are having that kind of ideas undergoing, but including, I mean, I think having veterans is the first thing. Saving taxpayers' money is the second biggest implementation of this bill. Third, I think having the opportunity to cut the staffing shortages that we have in the VA, the hiring process that is always so difficult. We are facing that problem in Puerto Rico, as a matter of fact, and of course, having the certification for the ICTs that you already have in place with remarkable reviews in so many areas. Why not having that as not just a choice of public policy in between the agency, but as a mandate of Congress? And that's the reason of this bill, and I do support it. And as you just said in your written statement, I do believe that you're supporting it.
Yes, we are in support.
Thank you. I yield back. I will do the same thing that just Mr. Higgins did.
Thank you, Representative Gonzalez-Colon. And we now recognize for 5 minutes Congressman Correa from California.
Mr. Chairman, we'll try to make it in two. How's that? Just wanted to very quickly say I also support Mr. Higgins' legislation, and wanted to also say that I joined Representative Hartzler in introducing H.R. 5521 to address the issue you were talking about, which is the physician shortage and the ever-increasing physician shortage. And I know that, Ms. Kelleher, I know the VFW has some issues, maybe some concerns. I hope we can work through those issues and make sure they're all on board, because getting good docs into the VA is an important goal, and I hope all of us can work towards that. With that, Mr. Chairman, I yield the remainder of my time.
You've been very kind with the committee's time. Congressman Correa, thank you very much for that. Votes have been called, so the panel is going to be winding down. I do want to make the editorial comment that the use of relative value units is not intended to be punitive. It's intended to be a measure of productivity and efficiency, and I think we have to get there somehow. Somehow we have to measure our efficiency, given the amount of the people's treasure that has been entrusted to us in this committee. With that, I want to thank the panel for the time that you've put in, and for coming up here and being willing to see us and talk to us and answer our questions. The subcommittee is adjourned.
Right.
It was exactly as expected.